And go live on Instagram. Boom.
Okay. Here we go. All right. I think we're on.
I think we're good. Welcome, everybody. Dr. Brandon VanderWel.
Dr. Tan, hello.
At Aviva, we're bariatric surgeons, and we are discussing today obesity, weight loss surgery, myths, and busting it up.
Busting it up. Or confirming. We have a little list. Some are myths, some are less so. So we'll kind of go through them. Well, let's start. I think we have one question from our website that we should answer before we jump in. I have a question from Trisha. Can you have bypass surgery after having the sleeve done? It's a pretty easy one.
Almost always, yes. Yeah.
Almost always, yes. Yeah.
Yes. Yeah. With rare exception, that's not an option. That is an option with rare exception.
With rare exception, yeah. And it's we don't have much background about Trisha, but reasons for doing a sleeve to a bypass, might get a little bit more weight loss, so weight regain can be one reason why people have that surgery. And then the other probably bigger one in my mind is if you have really bad reflux. That's an option that we have there as well. So yeah. All right. Well, should we jump in?
Let's do it.
Let's bust some myths. I have BS626. She says hi from Nebraska. She had the VSG 10 months ago. Congrats. And then Mindy switches us up. She's from Illinois and she's 4 months post-op from a modified duodenal switch. So cool. All right. Well, we have a little list of myths or not myths, just things, common bariatric statements that we'll kind of work through. So we'll start with bariatric surgery is cosmetic surgery. I get this all this time. I get asked all the time at like parties and stuff. So you're a cosmetic surgeon after I tell them what I do. So yeah. What are your thoughts?
I would say with very rare exception is bariatric surgery cosmetic surgery. Well, I would say almost never. Because bariatric surgery, like it literally is treating, a condition, which is obesity. And, people are like, well, weight's just a number, blah, blah, blah. But that's a ridiculous argument because blood pressure is just a number. Blood sugars are just numbers. And just because you don't have complications from those numbers yet doesn't mean that they're not very serious situations. And having excess weight on your body, it wears all your organs down. It wears your joints down. It decreases the things that you can do. It decreases the way that you feel. It decreases your energy level. Like it's just, there's so many benefits to decreasing your weight, even if you don't have a diagnosis like type 2 diabetes or a diagnosis like hypertension or sleep apnea. The benefit of losing weight and being a healthy weight is myriad.
Yeah. I mean, it's I think this is a whole topic right now, right? Like we historically have been called bariatric surgeons or like weight loss surgeons. And now we're starting to move to a new phrasing of metabolic surgeons, right? Which no one knows what metabolic surgery is, which is why no one uses it. But I do think it kind of hits the nail on the head a little bit more, right? We're not only operating to help you lose weight, we're operating to help improve your metabolic health in a lot of ways. But even then, I don't think metabolic surgery covers the whole gamut, right? People have surgery for all sorts of reasons. And I don't think there's one reason that's more valid than the other. Some people have full blown diabetes and they want to improve their diabetes. Some people want to lose weight because their joints hurt and it's hard to get around and they're not active. They can't spend as much time as they want with their kids. That's
Yeah.
valid. Some people want to live longer. That's valid. And some people want to like fit into clothes better and be able to shop at normal stores.
Feel better about themselves. I mean,
Exactly.
these are all normal. These are all completely normal and reasonable things to want out of your life.
Yes.
Yeah. And if a procedure that's safer than getting your gallbladder taken out can offer you that, like, what are we talking about here? So I'm getting kind of blown up in the chat here. Let's catch up.
Let's catch up.
So we have Monette. Am I saying that right? Monette. Thank you for all your comments. She said, I'm struggling. Have been suspicious since COVID. Feels like everything's, kind of breaking down. People treat you like crap. Lipo versus bariatric surgery. That's a great question.
Oh, that's a great one.
So liposuction is liposuction is a cosmetic procedure, particularly, and what it does is it finds fat, in certain places in your periphery. So you can only get liposuction can only address fat that's on, between your skin, which is like, the outside layer of your thing, and then the whatever is underneath it. So in your abdominal wall, right? People think that a common misconception is that if you're fat, all of your fat is between where your abdominal wall muscles are and where your skin is. And that's not necessarily always true. A lot of people still have a lot of fat actually underneath their abdominal wall inside their organs. And you cannot address that at all with liposuction. Additionally, liposuction, when you suck out places in liposuction, which is great and very helpful for reducing the amount of fat that you have maybe in that spot, but it still actually won't reduce the amount of weight that you'll lose with liposuction is actually very small. Yeah. We're talking like sub 8-7 pounds of fat, which it's beneficial for a lot of people if they're looking to contour, where they're like, hey, I just have like this spot that's really struggling, that I'm really frustrated with. You get a procedure and it can kind of eliminate it from that spot. But if you are more than 30 pounds overweight, the chance of you being really happy with your liposuction goes down very, very drastically. It's not probably going to do what you're expecting or want it to do. That's something where talking about a procedure that decreases the size of your stomach is much more helpful to losing fat all over the place and to living healthier in general. So a couple other questions here. Sorry. Do you have anything more to talk about on that one?
Yeah, I mean, I actually get asked all the time if I do liposuction, which I do not. but
actually, Vishal asked what kind of doctor is Dr. Tan. So Dr. Tan is a bariatric surgeon, and she does doesn't do any liposuction. So
no liposuction. But I think another point to add on though is that yes, so liposuction, you're removing that outer layer of fat, but really the fat that is unhealthy, like you can have like a little bit of padding out there, and that's actually like relatively healthy fat to have. The unhealthy fat that makes you metabolically sick is the internal, like deeper fat. We call it visceral fat that surrounds your organs. And that liposuction does nothing for that. And the other thing that is, I guess the other difference between cosmetic surgery and what we do is that the results aren't instant, right? Like after a cosmetic surgery, the day after you look very different. With our surgeries, we're changing your metabolism actually.
Yeah.
So we're changing kind of like the deeper base issue, I would say, when it comes to weight rather than the external. Because once you do liposuction, it's very easy to still regain all that weight after it's gone.
All right, a couple other questions here. Get caught up on. So this is Jeff asked, is it painful? Is surgery painful? So we do generally some nerve blocks around the spot where the incisions are. So the incisions are about the size of they're the size of the pinky, 2 the size of an index finger, and 1, right? And those are right below, to the sides of the belly button usually. And then the surgery one is right underneath the breastbone. We also do the end. You're sore from those locations because those are poke marks through your abdominal wall. We do nerve blocks to try to reduce that discomfort. But usually people say it feels like you got a pulled muscle in that spot. And so like when you move, when you twist, when you're laying down for sleeping for a few days, you're like, man, that's sore, and it kind of talks to you a little bit in the same way if you got like a pulled muscle would. We also do the endoscopic sleeve gastroplasty. So the endo sleeve, that is a procedure where you have a suturing device. It goes down through the mouth and no incisions at all, and actually can reduce the size of your stomach by suturing it down into a smaller shape. That procedure is not necessarily, I mean, sometimes people have some pain, like that's it, to say that there's no pain for anyone is certainly not true. But I would say the vast majority of people say like, oh, I just kind of feel like I had like a stomach bug, not necessarily pain, but like kind of like that blah feeling you get, you know, sick to your stomach for like 2 to 4 days, and similar to like stomach bug where it's like quick on, like, wow, that doesn't feel good. And then, you know, wake up one morning and it's like, oh, I'm feeling good. But you don't you have no incisions with the endoscopic sleeve. And so there's no like issues with moving around. People are generally getting back to exercise 7 to 14 days. So, Vishal had another question here. What if a person doesn't manage their weight after a procedure like this? Yeah, great question, Vishal. That is, surgery is a journey, or I mean, weight management just in general is a journey. And there's a lot of obesity fights dirty. And so having a team that is just committed to helping you make progress and helping dial things in. Obesity is a disease really like no other disease. It's a disease, clearly a disease of biology. You know, there's major biological factors that factor into obesity, but it's also, you know, a condition of behavior. And so working on both of those things, the biology piece with surgery, with medications, and the behavioral piece, working with our dietitians, working with your surgeons to really figure out how you're going to get everything together to really live your best life in the healthiest way. So, Dr. Tan, what do you think? What happens? How do you manage your weight after surgery?
You know, I think this is actually a perfect follow-up question for like the cosmetic piece, right? It's what I wish our surgeries were that it was like a magic bullet where everyone was 100% successful and our results were 100% consistent. But the tricky part is that surgery is a tool that makes weight loss easier for folks. And as with any tool, you do have to use it correctly. And that means significant lifestyle changes, dietary changes that have to come with the surgery in order for you to be successful long-term. I tell all my patients pretty much that I have the much easier job of doing your surgery. It's by far, it is the easier job. And then the much harder job is what comes after from my patients, right?
Along that line, I saw a patient today just before this in follow-up. She's like 6 months out. She's crushing it. She's doing awesome. But she's just like, it gets so annoying when people say that surgery is the easy way out. Like, you have to really restructure a lot of things in your life. You have to set yourself up for success. You have to make a lot of changes. Those things don't just happen, but they are way more doable now with surgery. It's all of a sudden I can do these things now. I'm not fighting my body. I'm working with my body to work.
Yeah. So. Yeah. I mean, and that was on the list of myths for us to bust, which is bariatric surgery is the easy way out. And I think it's actually like, it's how you look at it, right? Like, yes, we're making weight loss easier for you, but like you said, obesity, it fights dirty, right? It's a really unfair battle for our patients. Like, your body is built in a lot of ways to keep the pounds on and keep you at your current weight. And it's going to fight you every step of the way when you do try to lose weight. That's why it's so hard. And so you need tools. A lot of folks need some tools to help them. And that's what surgery is. It's a tool that makes things easier, but it's not easy. Even with surgery.
It's really not easy. Monette, hopefully I'm saying that right. I'm sorry if I'm not. She asked, are there any non-permanent bariatric surgery options? Meaning, are there options that could be removed from my body after years or otherwise be reversed? That's where the endoscopic sleeve actually does a really good. That's a very legitimate option there. Because those sutures, they can technically be taken out or reversed later, and you can have your stomach go back to a normal size. I can say that I have, I've never really had someone come back and want that. So it has happened out there. There's any number of reasons why people have that addressed, and they're out there certainly, but that's where the endoscopic sleeve is nice. It's very nice. It's a very nice tool to have a smaller stomach. And actually, there's a lot of celebrities that you will see on TV that have had endoscopic sleeves and also do GLP-1 medications. And the combination of those two together is very, very helpful. And there's no scars. There's no, the recovery is really, very manageable, usually like 2 to 4 days, like I said before. And yeah, it's pretty nice. So,
I would caution a little bit away from non-permanent surgery. It sounds like a nice thing in a lot of ways. The other big option that we don't do, but a lot of other centers do, is the gastric balloon. My concern with the non-permanent options is once it becomes non-permanent, once you reverse the thing that helps you lose weight, you do tend to regain weight. I would say most folks regain the weight. So
that's
there's good
true of
reason
anything that's
why
not
our
surgery.
surgeries are.
Yeah,
What was that?
that's true of like anything that's not surgery. Even like the medications wise, it's challenging. All these things, the procedures, the medications, they help with the biology piece, and it just shows you that when you remove that and you just have back to your normal biology, like it's just such a challenge, and you're just holding on for dear life on the behavioral side when you're fighting your biology part, which is why it's so helpful to have that biology piece help. So,
but that's also part of why the ESG, the endoscopic sleeve, people don't ask to get it reversed, right? Because there's really no reason to, unless you want to regain your weight.
Jeff had another question. Can bariatric surgery help my shoulder tendons? They click and pop with every movement. I don't know. I would say shoulder's an interesting joint to address. I would say almost universally, with very rare exception, people say that their back, their hips, and their knees and their feet just feel so much better after some weight loss, after these procedures. And these procedures, they are scientifically proven the best ways to lose weight, hands down, no questions asked, honestly not even close. And those joints certainly feel better. Shoulder-wise, I'm not sure. Dr. Dan, do you hear much shoulder one way or another?
I think it depends on why you're having shoulder pain too, right? I tend to think, like the knee pain, the hip pain, that definitely, like, those are just weight-bearing joints that just take a lot from excess weight. If you're a former professional baseball player and your shoulder hurts just because you've really used that shoulder, I don't know if weight loss surgery is going to fix that. But I do, I guess, not specifically shoulder pain, but I get asked about all sorts of like medical problems and whether or not they're going to be improved with weight loss. And with the exception of some very few exceptions, for the most part, we're more likely to see improvement rather than worsening. Like, I don't think your pain's going to worsen. And it might improve.
Extremely unlikely to worsen.
Yeah, exactly. So, and that's probably true for most medical entities. Generally speaking, obesity or excess weight is going to make things worse. So, all right.
So I had another question, Monette. That's do you think the future of bariatrics is using cadavers in surrogate body? I am not really sure where that one's going, but I would say
what's the question again? Say that one more time.
Is the future of bariatrics using cadavers in a surrogate body? So I would say that the one that this is the hard thing with obesity and with
I don't
weight.
think I understand that question.
She later says, "Thank you for answering." So I think maybe it was maybe I was confusing about something else. So, but it's like that's what's so cool, I think, about these treatments is that, like, right now everyone only has one life. Like, this is it, and obesity takes away so much of that, and it's so cool to see how much progress you can make in 3, 6, 12 months with this, and really give you the best shot of continuing to succeed long term. There's a lot of different tools, and we have a lot of great tools for us available to us. But man, if you're out there and you're struggling, like there's hope. Like, you can absolutely go down a path where you make progress and you start living better, which is super cool. It's super cool. So Monette said I sort of stopped the question and was kind of halfway through. So yeah. Yeah. Hey, Jeff said you called it. He played baseball and was throwing from home plate, and one day it just popped. Yeah, sounds like he was a catcher back there. So.
Okay.
Yeah. Michelle asked, do you do gynecomastia surgery? So that's a good question, Michelle. don't do a lot of gynecomastia surgery is certainly an option. And we do have a cosmetic surgeon that is kind of in the realm of the cosmetic surgeon. Her office is just down the hallway over there. If you have some excess weight, the first thing I would do before you address the gynecomastia piece is to try to address the excess weight part, because there might be significant improvements that happen because adipose tissue, fat tissue, has significant hormonal effects, particularly to testosterone. And so really addressing that issue of the weight piece and the excess fat piece can have significant benefits to the gynecomastia piece. And I would try to put that one first before you go after the gynecomastia piece, because the first one might resolve that issue along with many other things in your life. So, all right, am I all caught up on questions here? Thank you everyone for your comments. All right.
All right, should we move on?
I think we're good. I think we're caught up. Yeah.
Okay. So. All right. So our next myth is bariatric surgery is extremely dangerous.
It just depends on what you're comparing it to. If you're comparing it to getting out of the bed, maybe. But other than that, like, bariatric surgery is one of the safest major procedures that you can do. Like, safer than getting your gallbladder taken out, safer than getting a hysterectomy, safer than getting a knee or a hip. Like, it is there risk for everything in life is a calculated risk. But damn, this one has a big benefit, the risk that it is.
Yeah. No, I think it's surgery always feels extreme. Like I get that. You know, patients tell me that all the time. Like, this is my last resort. And in medicine, I think we do tend to kind of have this step up approach where we go with less intervention, you know, and then a little bit more intervention. And then surgery does tend to be the very last thing that we reach towards. But I think that's actually the wrong way for us to be looking at obesity and looking at excess weight. Yes, there is some risk that you're taking on when you do surgery, like everything that we do. Like you said, it is one of the safest surgeries that we do. You know, we both come from a general surgery background. Out of all the surgeries that we do as general surgeons, they're often related to excess weight. That's why
I'm a bariatric surgeon. You just get so burned out of like, okay, I fixed this problem, but I'm not fixing the upstream problem. You know?
Exactly. So, it's one of the safest surgeries. Like, if you go to a hospital right now and just look at the hospital board of all the surgeries scheduled, bariatric surgery is one of the safest ones. Mm-hmm. So you're taking on some risk initially at the beginning, but what you need to also think about is all the benefits that you have in the long term from accepting some of that short-term risk. It's an investment, so to speak. Yeah.
And the other thing too, like when you think about risk from that is also, so if there's a problem, if there's an issue, what do you do about it? Like, how does that get addressed, and what's the long-term consequences of that? And generally the nice thing is that with so many of our things, like it may be uncomfortable for a while, but we're going to get through it, and you're going to come out better at the end of it. So,
you know, one of the best things I've heard, or like one of the best like boiled down statements about this is that, like, you know, surgery typically takes us like 1 hour, maybe 2 hours for bypass, 1 to 2 hours of surgery. And that's adding 5 to 8 years of your life on the back end. You know, that's the best hour that you've spent. It's simplified because you have your recovery afterwards. There's a lot of hard work that goes into it, but it's kind of a no-brainer in some ways for a lot of folks. So,
couple of comments in the comments section. Is the risk higher because of the weight of patients being operated on, though? Good question. As the weight goes up, the risk certainly does get higher. Knock on wood, still, you know, like we do a lot of these, and we are very comfortable operating on patients that have really high weights, and you get pretty good at it. You always, it's like riding a motorcycle. You always respect it. You always take it seriously. You're always paying attention. But the way these operations have been really structured and honed and perfected to be very safe for patients. I wish I could say there was like 100%, never a problem, whatever, of course, but that's just not life. And it's like, actually, Jeff said this in the comment section too. He's like, yeah, there's risk in everything you do. I'm on the job site with big machines and cranes driving around. It's crazy, scary stuff to do there. So, but when people's weight is higher, it does make things a little bit more challenging because you're working, you can't see as well. There's things that, are harder to access. But we actually, people that have a lot of weight that they need to lose, we actually work with them very aggressively on the run up to surgery. And when they lose weight, they actually lose it preferentially from all the places right around where we're doing surgery. So it really sets us up for success. Even, it's crazy. Like you get in there, we say this all the time, like 400 pounds is not 400 pounds is not 400 pounds, right? You'll operate on somebody who's 400 pounds, but they've lost a decent amount of weight on the run up. And it's like, you're like living inside of a gymnasium and you're like, wow, I got tons of space. This is easy. No problems here whatsoever at all. And you have someone that's 100 pounds lighter, but they're just much more compact and they carry their weight differently. And you're like, this was a really challenging surgery. And I really had to use all the tools in my toolbox. But, that's the thing is that we have a lot of experience in our facility, in our office, and in our, in our own labs, and we help people get through. So.
And I would say, the risk goes up as your weight is higher, but I would also say that and I don't know if I have data to support this, but I would say you're the benefit that you get.
Your benefit is so much higher.
Much more. Actually.
Especially for men, actually.
Yeah.
Because men, this is the thing, like men just they don't survive obesity well. Like how many obese men do you see walking around out there that are 70 plus? Like most of them are dead by then. Like you get so many more issues for men particularly. And when you can go from even just a BMI in the 40s, so let's say you're like, 60, 80, 90, 100 plus pounds overweight, you lose a significant amount of weight of that. You're adding 10 years to your life, not just to mention how much better those years are.
So there's a lot of benefit there. Yeah. I was going to say something else and I just totally forgot. I don't know. All right. I have a question from Nicole. If acid reflux is going to be an issue post-surgery, how soon would your symptoms present? So I don't know what surgery Nicole had, but typically we're probably talking about a sleeve gastrectomy if we're dealing with acid reflux afterwards. I would say this is variable. I don't know if you have like typical time that you're seeing. Some folks it's a couple months out, and then some folks it's a little bit it's immediate pretty much after surgery, I would say. The other differentiating thing would be whether or not you had a hiatal hernia that we fixed during the time of your sleeve, and whether or not that like recurs a few years out, because that can happen as well. Nicole had a modified duodenal switch, so probably also does have sleeve kind of anatomy.
Sleeve action. Jeff had a question. What about 30 pounds? Is that bad? I think that's what you're saying. Is that 30? 30 pounds. I think 30 pounds is usually about my threshold of like people that are trying to lose less than 30 pounds, if they haven't, all other things being equal. 30 pounds, yes. There's the yes, 30 pounds is certainly worth considering doing a procedure for. If you are stuck and feel like you got 30 pounds to go and you're just like, man, I really would like to get this off, that can be a very legitimate option for you. We try to be very thorough and make sure we've kind of turned over everything to make sure that the risk is worth it. But for most people, if you just think about like carrying around a 35-pound weight or like a 35-pound backpack every day of your life, if you could do surgery to take that off, you would. Like, that's a no-brainer. and especially if you're a guy, that 35 pounds is probably in a spot that's not very healthy for you. So, yeah, absolutely worth having a conversation about. We're generally, I really believe this, that in the 21st century, we just don't need as big a stomachs as we have. We really don't. Your stomach is God made it that way so that you could survive very hard times and survive the winter. And when food was rare, when you had a chance to eat a bunch of it, you could do it. And that's why, which is just not really our problem in the 21st century anymore. So, Monette says, thanks for putting that into perspective. You're welcome. I heard ancestor used fat in dearth famine for a long period. Was that true? Exactly, Vishal. That's what I'm talking about. You the like he just texted that as I was saying that. Like 30,000 foot view. Like the reason that everyone in the world, like we think that America is ahead of the curve when it comes to obesity, but everyone's on almost close to the same trajectory as far as their obesity going up every year. And the reason for that is that in the 21st century, when you have living in and working in generally climate controlled areas, driving cars that drive themselves, you have refrigerators filled with food from Costco, running water, electricity. Like you don't have to go chop your own water. You don't have to carry it. Chop your own wood, carry your own water, go hunt your own food. And, you're not having huge famines. You're not dying of in the winter. We have air conditioning now in the summertime, pretty much, for a lot of people. Like it's crazy what our bodies are not made for this time. They're just not made for this time. They're made for hardship and scarcity. And that is why your body's very efficient. It's very efficient. It wants to get calories. It wants to save them because it does not think that obesity is actually a thing. Obesity is historically almost a non-entity. Like it's been so rare throughout human history. The only people that were obese were the people that were at the very, very, very top of the food chain. So. Sorry, I got going a little bit there, Dr. Tim.
I mean, it's a good way to put things into perspective, I would say. Yeah, it makes sense.
And that's why I really believe that, like, you just don't need that big of a stomach. You really don't in the 21st century. And that's where I believe it. That's why I'm aggressive about offering procedures to patients, because 75% of this country is at least overweight, if not 42% is obese. 30, it's like 20, almost like 17, 18% is severely obese. And so there's things that we need to do. Like we're clearly on the wrong path. And it's not just America, like every developed country, like in Asia, obesity is getting crazy, except for Japan. Like Japan's the only one that's not on this trajectory, essentially. Korea's a little bit, not quite as far up or as fast of a trajectory. China's going fast. A bunch of the other East Asian countries, they're going fast. Europe is on a very similar trajectory as us too. They're just behind. They aren't as advanced. They aren't as, as far on. But yeah, so it's hard. The stomach, having a large stomach, we see stomachs every day, right? And when you see that thing, it's an animal. It's a monster. It wants to be fed. It exists to get food, and it's going to talk to you and tell you that it wants to get food. That's what it does. That's how it's kept you alive. All of your ancestors alive for all of history. So, all right, I'll stop on my rant.
To get fed. It's a monster.
All right, Herschel B. Hi, Herschel. Herschel says, "Is Gatorade Zero too acidic during the clear liquid phase?" I would say no. I think Gatorade Zero is good. As long as, if it disagrees with your system, I wouldn't do it. Because, maybe sometimes artificial sweeteners generally can make people feel weird. But usually I don't think Gatorade Zero is really too acidic at all. It has some, electrolytes in it, but usually I think its pH is pretty balanced. So
yeah, I think that's fine. I feel like
strong feelings about Gatorade Zero, Dr. Tan?
No. If you can tolerate, I mean, everyone's different. Some things sit well with some people can't tolerate other things. So one of my patients do tomato soup, which you would think would be really acidic and not something that would sit well, but a lot of people do well with it. So.
Yeah, I hear that too. That's been always a surprise.
Yeah.
Manette brings up a good point. Still, Antarctica is still holding it down. 0% obesity right there. So. And Jeff says, is the stomach or the fat stored what makes it bigger? So I'm not entirely sure what you mean by that question, but the stomach is a stretchy bag. That's what it is. It can stretch out to a very large size. Generally, I kind of think of it, you can fit like almost 2.5 grapefruits worth of stuff in there, or like 1.5 liters, close to some people. And then you can even stretch it out even more. So like, look at the food eating contest people, like the Kobayashi guy, right, with the shake. Like they train their bodies to actually stretch out their stomachs. And if you have any number of medical conditions actually where things aren't going through well, it'll stretch that stuff out as well. And so when the stomach can stretch and it wants to actually, you can have active relaxation of your stomach. And that's probably when in the evening time, that's what happens, why you feel more hungry in the evening. And you have more contraction of those smooth muscles of your stomach, like in the morning time, which is why generally people's desire for food and your pull towards food is very different at different times of the days, because there's a lot of hormones in your body that are affecting what your, any number of hormones, but it certainly also affects the size of your stomach too. So when your stomach is big, the stomach is a very hormonally active organ. I kind of describe it as the symphony, the conductor of the song, of the symphony that is your body's complex metabolism, hormones, control of its weight, control of its blood sugar, control, even to some extent, blood pressure. And the active part of that is in the mucosal lining. So those are the hormonally active cells all along the inside of the stomach that are wanting to interact with food. They're talking to your body saying, we need food. Give us food. This is how you survive. Give us food. There's receptors of that hit dopamine buttons in your brain when you get food. There are stretch receptors inside of your stomach that say, not just like say, hey, stop, like when you overstretch a muscle, but actually when you get to a certain stretch, like there's some dopamine receptors of pleasure that say, this is a good thing. We're going to survive the winter now. We should continue doing this another time soon. And so that is what, that's what that organ is, that is your stomach. And when you just make that thing smaller and go from that big bag down to a small tube, there's just not as many cells in there. You changed how quickly those stretch receptors can get activated. It helps so much. It helps so much. So didn't I say I wasn't going to go any more rants?
Well, I think this is a relevant one.
Yeah.
I think this is actually the biggest we don't know question that people have if they've had bariatric surgery, which is, can you stretch out your pouch after surgery, or can you kind of stretch out your sleeve after surgery? What are your, and I think everyone, it's very controversial, I would say. I think everyone,
I don't know why it's controversial. Like, the stomach's a smooth muscle. Every smooth muscle can stretch. Like, every tissue in your body can accommodate stress.
Yes.
Bones accommodate stress based on the stresses that are put on them. Ligaments, connective tissue, smooth muscles in general, organ systems, like they adjust to stress. So to think that you couldn't stretch out your sleeve, seems like crazy talk to me. So, because like, if you have an obstruction of your colon, of your small bowel, of your stomach, upstream of that obstruction, where it's going to dilate and it stretches out, and it's going to take at least as much time as it took to stretch that, to unstretch it. And it can get better, because like, those smooth muscles, they still, as long as they still have some connection and their natural inclination is actually to get tighter. So I think there is some value in like almost like a pouch reset diet, but not in the way people usually think, which is like to go back to the liquid phase. I think it's to just be very, very deliberate about your portion sizes. And we see this like in the old like duodenal ileostomy surgeries that they used to do, where they would, bypass big portions of the small intestine, and there was essentially just a blind limb. That tiny amount of what would happen, and we see this in gastric bypasses too, like the remnant stomach, that it just condenses down. It just gets really small, and it just kind of comes down into it's not technically a knot, but like the small bowel would go into like finger-sized tissue, where usually that small bowel is like this, you can actually put your hand around it. It would atrophy technically, and you would just kind of tighten down into like that small little, almost appendix looking type of tissue. So.
Yeah, I mean, I think the concern that people have is like, can I irreversibly stretch? Like, yes, the stomach is a stretchy organ. That's the whole job of the stomach. The question is whether or not I can irreversibly stretch out the stomach. And I think in some ways, what I tell my patients is like, we don't actually know the answer to this, because we don't ever like measure someone's sleeve pre-op and then measure someone's sleeve 5 years out. When people have revision surgeries and they have a dilated pouch, it's very possible that their original surgery, they didn't get as much tissue as they should have, and it started out with as a larger stomach too. So we don't know for sure whether you've stretched out your pouch if you have a dilated one, but you're right in that. I think absolutely, we know from seeing like for the gastric bypass, we make a connection between the small intestine that dilates over time, right?
Yeah.
And so I think we know that these organs are able to stretch out. And so we do have to be careful with our stomachs and with our sleeves. And I think what we teach our patients is to measure out their food after surgery and to kind of stick with a certain portion size with every meal. And the idea with eating after surgery shouldn't be going to a point where you feel super full or even a little bit past fullness. And maybe not even eating to the feeling of fullness, but learning to eat to just a feeling of I'm satisfied.
Yeah, 75, 80%. And you're like, that's where that portion size, I tell people all the time, that's my most important message is your stop sign for eating, portion size.
Yeah. Which in some ways, like, again, because we are built in a way to overstretch our stomachs because we want to keep calories in and not get rid of them. Sometimes we can't trust our bodies too. We can't trust our own hunger cues. And so that's where measuring and being careful is actually really, really important, I think, and protecting your sleeve as much as possible.
Jeff had a question put in the chat. Does microwave food mess with your digestive system? Good question. Do I think microwaving food like in plastics or stuff that can seep out other chemicals into your food? The data on that, I mean, it seems to be kind of all over the place between no effect at all and this is the worst thing of all time. And it's hard to sort out like what's actually true there. From a general like scientific perspective, do I think having a bunch of chemicals into your food is a plus? Probably not. I think probably going with green with glass, when you're microwaving stuff is good. Does the act of microwaving itself, this may be more alluding to a little bit to the question, does the act of microwaving itself actually damage the food? Dr. Tan, do you want to address that one?
I would say this is outside of my expertise, but I don't think so.
Yeah, that's going to be my answer.
Has nothing to do with my medical training, unfortunately, but I don't think so.
Microwaves, the way that microwaves work is that they help particularly water molecules vibrate. And the frequency of the energy makes those molecules vibrate, which turns into kinetic energy. It's not necessarily, it's not like you're slamming them with gamma particles. So I don't really worry about my food being radioactive coming out of a microwave because it's not really like radioactive particles. It's just wave energy. But, I can understand where people have their concerns. And I'll be the first to say that I don't really see it's really hard to know science-wise either way. And also not my most expertise thing.
You're already way ahead of me. I'm like, what's a gamma particle? I have no idea. But I microwave my food all the time, so.
Yeah. Vishal said, obesity problem in unnatural birth, like test tube IVF person. That's a good question. Is obesity more of a common problem with people that don't do IVF or other fertility treatments? Have you heard it? Have you seen any data on this either way?
So do people who go through IVF have more? Do they tend to have more
obesity issues? Yeah.
Oh, that's a good question. I feel like that's probably I haven't seen any papers on that or seen any data specifically speaking to folks who have done IVF, but we know that there are hormones that are going to, and I don't know the specific hormones that you're getting with IVF. I'm just not familiar with that, but looking at just contraceptives that are hormonal, that we know can contribute significantly to weight gain for women. And so I imagine that there is a lot of correlation there as well. The difference with IVF is that it's a relatively short period of time that you're going through that, versus a contraceptive method that's going to stay in your system for potentially way longer. We know that those hormones can cause weight gain. Absolutely. Yeah.
I would say from is the child more likely to be obese?
Oh, is that the question?
That might be the question. I would say this is funny that you actually asked this. This is maybe one of my most clever moments in medical school. Actually, this is my answer to this one. we had to work with an OBGYN was given a lecture, and he asked, why are infertility rates, like people struggle with fertility, why are those rates going up?
Okay.
And I said, well, because we have fertility treatments now, people are having babies that would never have been able to have babies. And that is from a genetic, like just a evolutionary biology thing, natural selection. Like we've changed that aspect. And now that's a problem that we've never had before because it's never been an option.
Problem we've not created, but now recognized. Yeah.
Yeah. And so I think there's an element that may be occurring with that is that obesity does affect fertility significantly. And if we're doing and if people are now able to, with treatment, certainly that would not have been able to have children before, are having children, that may affect that piece. But at the same time, obesity rates have historically never been what they've been. And so obesity being an infertility issue has really never been a problem until the last really 40, 50 years, barely even that long. And so it's really hard to say. Like that's a great question. I don't know. And I haven't seen any data either way saying it's from IVF or fertility treatments in general struggle more with obesity. But yeah, that's certainly that's an interesting thought.
And that plays off of probably one of the most common questions I get from my patients that are younger women is like, how will surgery impact my fertility? And I do think it's not a very common one, but I do think there's some misconception that it's harder for folks to get pregnant after surgery, which is not true. Pretty much globally, like your fertility is going to improve after surgery. Yeah. 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 Actually, we warn our patients about that before surgery.
Yeah.
And then your pregnancy tends to be healthier too, because you are healthier.
Way better.
But it's true that we actually tell you not to get pregnant for the first year after surgery. So I think that's maybe where it comes from, because we want you to kind of know how to eat before heading into a pregnancy. And then we also want to make sure that you're losing all the weight that you can lose first.
Yeah. Monette said, what you said about measuring your cues is so relevant. Just did a 7-day fast. And on day 3, I learned a lot about my own baseline. Hunger was much more product for my brain. Boredom, emotional eating, hunger. It was an eye-opening experience, and I thought I was aware of the emotional coping aspect, and I was shocked to realize it was more prolific than I was aware of. Yeah, that's always a really fascinating exercise because your body, it's just crazy. For almost everybody, you can survive on an incredibly long amount of time without eating. And that being like 7 days plus. Yeah, for almost all of us, regardless of even where you start. But it's a very interesting physiological exercise for sure. So, and mental and a lot of existential almost even. So, thanks for the comments. Jeff, well, I've read that if we ate food from 1930s, we'd throw it up. And if they ate our food, they couldn't eat it either. Maybe some stuff. With the preservative stuff.
Yeah, a hot Cheeto. Yeah. I don't know.
Yeah, I think they would. Yeah, I think that would be a very interesting aspect. I mean, I've gotten into reading a lot of books from the age of sail lately, and the stuff that those sailors ate like 100 years ago, like in the 1800s and stuff. I mean, that was crazy what those guys were eating. Like they're eating like.
What is this book that you're reading? The book of the Age of Sail.
Yeah, Age of Sail. Well, no, it's like, so I read, Endurance. Have you read Endurance before? Endurance is kind of like one of the last Age of Sail. I mean, it's a sail ship.
Oh, this is like a genre of book?
Yeah. Like the Age of Sail is kind of like, majestic sailing ships, with big masts and stuff like that. Kind of spanning from probably 1400s to late 1800s. Yeah, early 1900s. So. But like I read Republic of Pirates, which is about piracy in the East Coast, Caribbean, the Americas, around that time frame. Just finished Wide Sea, which is about Captain Cook and his journey, his third journey, which was crazy. That was a great read. Just the stuff those guys ate all the time was crazy. Yeah, like they'd be eating moldy bread for all the, because they, and super salted pork, stuff like that. So
I don't know if I could stomach it. So,
So,
Nicole asked a really good question.
and I'm sorry for your loss, Jeff, too. See that in the comment. So, all right, sorry. Continue, Mimi.
Yeah. So Nicole asks, when people struggle with regain after surgery, is it simply that they're consuming excess calories? I would say, like, yes, that is kind of the very simplified answer to that question, is that you are consuming more calories than you're burning. Like, at the end of the day, that is what causes weight loss or weight gain, right? But it's in some ways more complicated too, because when you are at that lower weight, you require fewer calories than you did when you were at a higher weight. And then your hormone balance changes significantly too when you're at that lower weight. So your hunger cues change over time after surgery, related to those hormones. And so,
It's a
like,
moving
yes
target.
and no,
Yeah.
I would say.
It's a moving target.
It's
For
a
sure.
moving target. Like, you have to, the lower the weight that you are, the fewer calories that you need, the more exercise that you need. You've also, like, lost muscle in that process. And so your metabolism has changed too, which is part of why you need fewer calories.
And your body's just not working as hard to stay alive. You know, it's not, your heart's not having to push stuff through as much mass. You're not having to move as much. Like, when you move, you're not moving an extra however many pounds. Like, that, everything is more efficient. And as you exercise too, your body gets more efficient as you exercise. That's why, like, elite athletes, they can burn way less energy than someone that's not as well trained, even though they're going faster and doing other stuff, because they're just their body gets so much more efficient.
Yeah. And then I think the natural next thing though is, like, so do you just have to eat less? And it's like, I think, yes, that's the simple answer, that you just have to eat less, but there's nuance in terms of how we can, like, manage that, in terms of helping you eat less. So that's something that you're struggling with. Always reach out.
Yeah. Managing your weight's a team sport for sure. It just needs lots of support, needs lots of help. You know, I think of this all the time, like, professional athletes, even the people that are like the best in the world, undoubtedly still have coaches, sometimes multiple coaches. And it's like, do you think no one knows how to play this game better than them, but they still have people in their lives that help them, like, you know, take a look from different perspective, encourage them, hold them accountable to things, change things up, help them change things up a little bit. Like, that's such an important part of success in life.
Yeah. So. That's a great way to think about it. Yeah. Like, can Michael Phelps, like, swim really fast without a coach? Yes. But yeah. Does he have a coach? Yeah, absolutely.
Yeah. Is he going to win 8 gold medals if he doesn't have a coach? He's absolutely not going to win 8 gold medals.
Maybe he'll win 5, but not 8. Yeah, exactly. So
yeah. That's just like, you know, and swimming, I don't want to downplay swimming, but, like, swimming is like, get in the pool and swim fast, right? of all the different sports, like, there's, like, the nuance there. There's tons of nuance in swimming, like the form and, you know, strategies about what all these things, and training's huge. But it's just a great example. Like, his coach is like a big deal. Like, it's so integral to the success. So
yeah, I mean, that's the nuance in eating less, right? Because there's nuance there. It's not just...
Yep. Yeah, Captain Edward Blackbeard died from 5 stab wounds and 5 gunshots and was still fighting. The guy. Yeah, I know the stories from these things are just crazy. I would say, if you have not read a book though, and you want a good read, Endurance. Like, pretty much everyone will think Endurance is a good book. That story is incredible. Yeah. Anytime I think about complaining about anything, I just think about Endurance, and that's what those guys did to survive. All good stuff, by the way. Except they had to, you know, eat some penguins and some seals. So if you're not into that,
spoiler alert.
Yeah. But it's that's a great story. That's an incredible story.
Endurance. Well, sometimes I do need some reminders to stop complaining. So
yeah, anytime I think about complaining, I'm like, man, I'm not in the dead of winter in Antarctica, you know, in the like, literally in the dark all day long. Anytime I think about, like, oh man, here comes the gray, right? It's like, well, I'm not in Antarctica. I'm stuck on the ice. Sure. So
all right. Well, it's been almost an hour.
yeah, we should. I think we both have patients at 1, so unfortunately, we got to wrap it up.
Yeah.
Thank you, everyone, for your comments and for.
Sorry, before we wrap up, Beth just asked a question. Is it ever too soon to consider adding in a GLP-1? She's 4 months post-op and not losing at a rate I thought I would, which I know is okay, but it's hard not to compare. I think that's a great thing to chat with your bariatric surgeon about. I will say, like, surgeons and physicians, they have different opinions about how quickly you can start a GLP-1. I think we are both very aggressive in terms of getting our patients on GLP-1s. If we
I'd have everybody on a GLP-1 if I could.
Yeah. I think they're so helpful.
That's the future. Yeah. And then you'll only take it off if you're losing too much weight too fast.
Yeah, and I think even like slow weight loss, and just if you feel like you're starting to feel more hunger cues or more cravings, like those are good reasons to start a GLP-1 potentially early after surgery. So definitely worth chatting with your bariatric surgeon about. I think that's absolutely something that could be beneficial. But well, we only got through half of our myths today.
And Vishal just asked another question: who should go for surgery and who should? Yeah, that's a big question. Unfortunately, I can't address that one entirely, Vishal. But I would say, as a general rule, with rare exception, if you're struggling with your weight, you should at least reach out and have a conversation. Yeah, because these tools can be very, very helpful. I mean, it's just so helpful to have a smaller stomach. So it's worth having a conversation. It's worth having, like, just knowing what the options are and things like that. So
if you're struggling,
this is my algorithm for that, which is I want to lose weight. I'm willing to do what I need to do to make changes to live a healthier life, and I need help. Boom, we got tools.
I think it's as simple as that. And maybe when we talk or whatever, like, it's not, maybe surgery isn't your best option, but then there are other options that we can talk about. But if you need help, you need support, just that's what we're here for. So
absolutely.
All right. Okay. Well, maybe next time we can do the rest of our myths. All right.
Cool.
Okay.
All right. Thank you, everyone, for tuning in. And always feel free to reach out at avivamd.com. That's how you can get whatever you're looking for started. We're kind of scary. I'm just kidding. Everyone is really nice, and they just love helping people and love helping you. So have a great day, and thank you all for tuning in.
All right. Bye.